Thank you for attending this breakout session. This session is filled with powerful information to help improve your health and empower you. Radio Free 102.3 KJLH. We are you.
At LA Care, community is food drives and back-to-school events, resource centers in your neighborhood, scholarships for future doctors, wellness programs and virtual care, affordable health care for all. Now more than ever, we are here for our community. For Covered California Enrollment Assistance, contact us today.
Greetings, everyone, and welcome to the Alzheimer's, COVID-19, and the African American Community Panel. My name is Mona Tisdale, and I'm the Lead Product Solutions Manager for Cal MediConnect at LA Care Health Plan, the largest publicly operated health plan in the country, covering more than 2 million residents in Los Angeles County. In my role, I am honored to serve and educate our enrollees as well as our community with important information on preventive care, patient safety, community resource information, and more. And today, I have the privilege to moderate what promises to be a rich and insightful conversation about the ways COVID-19 has impacted African American seniors with Alzheimer's. We will discuss what we have learned so far and what are the most pressing issues we still need to address. On a personal note, this topic is near and dear to my heart. At the very start of the pandemic, I lost my beloved mother, who for years suffered with dementia. There was a very confusing time. It is still a very confusing and painful time. I know I'm not alone. I know there are many in the community that have been impacted the same and are eager to hear what the specialists have to say. So without further ado, we're going to go ahead and get started. Let me introduce to you the impressive roster of panelists that join me today. First panelist is Petra Niles, MSG. Petra is a gerontologist and current senior manager of African American Services, Education, and Dementia Care Networks at Alzheimer's Los Angeles. She has been with Alzheimer's Los Angeles for 12 plus years and has an extensive background in aging issues and the larger community. By bringing together community members and professionals from various agencies, Petra seeks to increase awareness of Alzheimer's disease and improve service delivery. Thank you so much, Petra, for being here. Our second panelist is Dr. Karen D. Lincoln. Dr. Lincoln is an associate professor in the Susan Dvorak Peck School of Social Work at the University of Southern California. She has published over 70 articles and book chapters in the areas of stress, aging, and mental health disparities, and is an active public scholar and aging advocate. Dr. Lincoln is actively engaged in African American communities. She is founder and chair of Advocates for African American Elders, a group of governmental and non-governmental agencies and community advocates whose mission is to be an active voice in the development and enactment of policies and culturally relevant programs that impact services to African American older adults and their families. Thank you so much, Dr. Lincoln, for being here. Our next panelist is Dr. April Thames. Dr. Thames is an associate professor of psychology at the University of Southern California. As principal investigator of several grant-supported projects, Dr. Thames has developed a translational neuroscience research program that focuses on the impact of chronic disease, substance abuse, socioeconomic disadvantage, and lifetime stress, adversity, and resiliency on neurological, cognitive, and mental health outcomes. She is actively involved in national professional organizations in her role as member at large for the American Psychological Association Society for Clinical Neuropsychology and former role as past chair of SCN's Ethnic Minority Affairs Committee. Thank you, Dr. Thames, for being with us today. Last but certainly not least, we have Dr. Donna Benton. Dr. Donna Benton, PhD, is a clinical psychologist. She was co-chair for the California Task Force on Family Caregiving, which led to a report which outlines recommendations for supporting family caregivers throughout the diverse communities in California. Dr. Benton served on the Stakeholders Advisory Committee for the California Master Plan on Aging, which was released this year. She is a caregiver to her parents and was to her grandmother. Thank you, Dr. Benton, for being here today. So, ladies, let's get started. There's a lot of questions that the community is in need of answers. And I'd like to first start with Alzheimer's and dementia. What is the difference between the two? On the outside, they look the same. Symptoms are very similar to the layman. But I'm going to ask Petra if you could provide us with a definitive response on how we can tell the difference between Alzheimer's and dementia, and also speak to the warning signs for both, please.
First, I want to thank LA Care and KJLH for coordinating this very important session. What is dementia? Dementia is a general term that relates to the loss of memory, the inability to solve problems, challenges with thinking, performing daily tasks, and exhibiting social behaviors that are not the norm. And so there are various kinds of dementias. We have Lewy bodies, vascular dementia, frontal temporal dementia. However, Alzheimer's is the most common type of dementia. And so that's the definition of dementia. Alzheimer's, as I just said, is a type of dementia. Alzheimer's is not a new disease. It was diagnosed in 1906, and it's named after the physician who identified it back then. And also, along with Dr. Alois Alzheimer was Dr. Solomon Carter Fuller, an African-American from, I believe, Africa. His family was from Africa. And so there was an African-American connection way back in 1906. This is a progressive disease. There is no cure for it. It is the 6th leading cause of death in the United States, and it affects African-American families more than any other ethnic group. So what are some signs or symptoms? Sometimes a person may become challenged with finances, balancing the checkbook, paying bills, overpaying bills, not paying bills. It may be some challenges with driving. It may be getting lost in familiar places. If you live in the neighborhood for about 40, 50 years and just going to the store a couple blocks away and having difficulty returning home. There may be changes in personality, the ability to organize. There may be repeating of stories, repeating of questions. These are just some of the signs and symptoms that may identify a need for a doctor's visit.
Thank you. I found that when my mother had began experiencing some behavioral changes, I noticed right away, and it was very difficult for me to get a doctor to diagnose her with dementia. It was very frustrating because I knew something was terribly wrong. Her behavior had changed in such a way that she became someone else. Is it, and then also the social workers that I reached out to seem to also miss some of the signs. It took me years actually to obtain the correct diagnosis for my mom. Do you have any suggestions for families who are dealing with a loved one who has experienced these symptoms? And in your heart and in your gut, you know something is wrong, and you're getting nowhere fast.
One of the important things is to not diagnose someone. It's a difficult diagnosis. It doesn't come easy. There are so many things that the physician has to do, weeding out what is not going on, that the person isn't having mini strokes, the person isn't depressed, and so many areas that they do a full workup, looking at family history and so many other points. But again, do not diagnose, contact the physician, make an appointment for a workup. And it is important that the person is able to share information about what they're noticing so that the physician can also make the proper diagnosis.
Thank you. And Pedro, why is it that women seem to be more at risk of this disease?
This is still something that's still being studied. There are a number of areas that has been identified in research. However, as I mentioned, research continues. Women live longer, so increasing age. Women are also have higher incidences of blood pressure, cholesterol, blood sugar issues. Women are impacted because of the finances that sometimes come about as it relates to caregiving. There are caregivers. They have to balance quite often work, their individual families, and the person that they're caring for. And during COVID-19, certainly the additional stress of that and making sure everyone is well in their families. Women are also at risk. It has been mentioned that there are some hormonal issues that, again, research continues with that.
Okay, thank you very much. It's very informative. I appreciate that, Petra. I'd like to ask of Dr. Lincoln, are African Americans at higher risk of having Alzheimer's, and why? Do racial disparities contribute to that, and how?
Yes, so African Americans do have a higher risk, as Petra noted. Petra also noted that there are certain chronic health conditions that are associated with Alzheimer's disease that are unfortunately more prevalent among many African Americans, such as diabetes, hypertension, cardiovascular disease, obesity, et cetera, right? So these are all sort of known risk factors. The only evidence in terms of a risk factor is age, right? That's the only real connection that we have. So older people have a higher risk, but there are also some suggested risks that have a lot to do with chronic health conditions. And so I think because African Americans tend to have a higher prevalence of some of these chronic health conditions, where we see a higher risk among this population. Also, I'm a sociologist and a social worker, and so I pay a lot of attention to the social factors and the social determinants of health. But even more than that, the societal determinants of inequity. And we know that place matters, right? Where you live definitely matters in terms of your health. And so we can see in certain neighborhoods, because of poverty and some disadvantaged characteristics of neighborhoods, you can see a higher prevalence of Alzheimer's disease among African Americans. And it has a lot to do with the lack of access to resources and healthcare, lower levels of education, lower levels of income, right? So I think that in addition to some of the biological and genetic links, as well as the health links, we also have to look at those social factors that really determine the kind of health that we have, that really determine the access to care that we have. So I tend to link the disparities that we see in Alzheimer's disease by race to the social determinants of health.
And so with the risk factors involved and the social determinants of health, what can we do to reduce the risk of dementia, the risk of Alzheimer's?
Right. So, and I'm glad you asked that question because I wanted to make sure that people understand the difference between prevention and risk. So as Petra mentioned, Alzheimer's, there's no cure, right? And you really can't prevent it, right? But you can take measures to reduce your risk. And so, the analogy of wearing a seatbelt, right? Wearing a seatbelt will not guarantee that you won't get in a car accident, right? But it certainly will help prevent you from serious injury, right? So we can reduce our risk in many of the same ways that you reduce your risk for hypertension and diabetes and obesity and say depression, right? You can increase your physical activity, watch your diet. I like to tell the clients that I work with to, Scrabble,
Yes.
card games, Bid Whiz, dominoes. I mean, these are all brain games, and they're really important for us to engage in those brain games. And many of us are doing that and don't realize that we're actually exercising our brain when we do those things. Getting good sleep, which is sometimes difficult. African Americans overall have the poorest sleep quality in the country, but getting good sleep is also important because sleep deprivation and poor sleep definitely increases your risk for Alzheimer's disease. Something simple as, when we are all sort of traveling regularly again, taking a different route to the grocery store, taking a different route to church. I mean, all of these things exercise your brain and are really important to help reduce your risk.
Excellent. Thank you.
You're welcome.
Lincoln. And so the question that I have, and this is really for each and all of the panelists, how do you work with the African American community within your scope? And we'll start with, let's begin with Petra, please.
Thank you for that question. For me, working with the African American community is part of my large scope of work for where we bring awareness and education about the disease and to make sure that they understand their risk for the disease. And so it's important to be educated as much as possible before something happens, and to also make sure the community is aware of our services that we provide, the programs that we have, the availability of a care counselor so that they can speak with someone regarding planning and someone to answer any questions they may have. We also have collaborative partnerships with the local churches, organizations, agencies, and we're happy to work with many more because we do know that this is a disease that will affect our community even more as the future predictions. There are larger numbers that are expected to have individuals living with this disease. So we are happy to provide services to family and those who have a diagnosis of Alzheimer's.
Excellent. Thank you. Dr. James?
Hello. My work largely focuses in two areas. One is research. We know that a lot of the studies, particularly around Alzheimer's disease and looking at brain outcomes, in just looking at combinations of pre-existing conditions, et cetera, largely these studies have not included African Americans historically. So most of our knowledge has been on predominantly non-Hispanic white populations. So that is something in my research I'm trying to improve by being very inclusive, more inclusive and focusing on the African American community. The second part is with patient care. And I see a lot of African American clients in practice, and particularly when the question comes up around dementia. And I have noticed that diagnoses are often made much later, which means that a lot of things that Dr. Lincoln talked about that could be done, at least preventatively to sort of help stave off some of the severity of the disease, that often that opportunity is not happening because by the time that the diagnosis is made, it's often very late. So that's something I would like to contribute to and change.
Excellent. Thank you, Dr. James. Dr. Benton?
I think for us, we've really been working a lot with the church and being able to have support groups that allow for that community feel and being able to discuss how we're feeling, share resources, because sometimes some of the best learning comes from somebody who may be just a few years ahead of you, has had a little more experience. And so this kind of peer sharing among our in the faith-based community and among other African Americans. So that's really our center also has family consultants who are reflective of the community and are able to discuss what's going on, from being able to understand, where are the legal resources in the community, what can we discuss in terms of looking for other types of help. And of course, we also are always addressing those preventative things that we can do, like exercise and diet that Karen mentioned, but also how we take breaks, how we think about um, our, our ability to say why it's okay for us to take a little self-care. And so we really talk about self-care, and that self-care is more grounded in how we as African Americans want to have that self-care. So sometimes it's, playing a really good game of bid whist, but also being able to watch some shows and being able to talk to somebody, and when we can again have meals together, being able to do that.
Well, you bring up an excellent point, Dr. Benton. Self-care in the African American community sometimes comes across as being selfish. Women are, raised to care for others, and oftentimes caring for oneself is taking away from the time that you could care for others. And so, how do we change that thought pattern and really communicate to the community the importance of self-care and what that looks like?
And what it looks like. Wonderful, wonderful question. I think, first of all, we have to remember that what is our value? Our value and our goal for helping our mom or our dad or our auntie or whoever it is that we want to be there the entire time that they are sick, and we want to be there from the time that, until we no longer have them and they transition. Well, we're not going to be there that whole time if we get sick, because that's usually what we'll say. We'll say, oh my goodness, if I get sick, who's going to care for them? So that's why if you remind yourself that self-care means that you are actually finding a way to last as long as they're going to. We don't want to, we hear stories of, oh, she was taking care of her mom, and she passed before her mom, and she was healthy.
Mm-hmm.
And so reminding ourselves that if we want to be there in the long run, then we have to take those little breaks. And it doesn't mean that you're running away from your responsibility, or that you're, that you don't have a right to do this. It's really so that you can be there for that person. And what does that mean? That can be as easy as having somebody, a neighbor, or, now, of course, with COVID, we always have to be careful, but having somebody else take the time, maybe 10 minutes, so that you can just drink your coffee without having to worry for those 10 minutes. It's being able to learning some deep breathing exercises that you can practice all day long, and just take a breath, because that helps clear our minds. It's getting that little extra sleep that helps you be able to re-energize yourself the day. It's listening, for me, I've turned it into listening to music and dancing around my house like an idiot. And it doesn't matter who's watching, because that just gets it out for me. Sometimes it might be screaming into a pillow. All of these things can be self-care. Now, if you have more time, being able to walk away. But, say that you're caring for your mom or your dad or your auntie, and you have a dog. When you take that dog out for the walk, don't think of it as, oh, I've got to take the dog for a walk. Think of it as, I get to walk around the neighborhood, and I get to wave at people, and I'm going to look at the flowers and the trees, and the dog's going to be out there, but enjoy that little bit of time out instead of thinking of it as a chore. So there are different ways we can take care of ourselves, but know that it's because we want to be there for the person we're caring for.
Absolutely. And I think that's also where respite comes into play as well. And
Yes.
ensuring if you are a full-time caregiver that you have access to respite care that is available. Another
And,
is, oh, go ahead, please.
and I was just going to say, yeah, I mean, that's why it's important to reach out to organizations like the Alzheimer's Association or the LA Caregiver Resource Center at USC. They have respite care.
Yes.
And so you can reach out and see how they can help you get respite. And so I think it's important. But one thing is we have to begin to self-identify as a family caregiver.
Yes.
You know, we know we're the daughter, we know we're the husband, but many are the wife. But sometimes we don't think of ourselves as and we're also a caregiver, because we say, oh, well, that's somebody I pay for. But once you say those words, it opens up a whole avenue of resources for you. So it's okay to be a daughter and a caregiver.
Absolutely. Thank you so much. And I'm just going to add, drink lots of water. I've found that drinking water can really just get you going in the morning, and it helps with your energy throughout the day. So I'm going to add my personal suggestion there. I'm going to turn back to Dr. Lincoln. I would like to give you an opportunity, Doctor, to also share the work that you are doing with the African American community.
Sure, thank you. So most of the work that I do comes from Advocates for African American Elders, the program that I started back in 2012. And I'm the only academic. Everyone else comes from the community and has worked with African American older adults for 20, 30 years, and are older adults themselves. And so one of the things that we do, Petra mentioned this as well, is we go out and do a lot of education. We go to churches, but we also go to senior housing communities. We go to senior centers. We do focus on places where African Americans gather, social clubs, block clubs, fraternities, sororities, etc. But from doing this work, we also realize that there are symptoms and signs of Alzheimer's disease, but many African Americans don't recognize those signs. And so on average, it takes 7 years before African Americans actually go to the doctor and mention that they have concerns about their memory loss. And so we decided to create BrainWorks, which is a culturally tailored intervention for African Americans. And we use talk shows to talk about the signs and symptoms, not PowerPoint presentations, but something that's very engaging. We use text messages that are tailored for African Americans. And so you have your sort of 20 signs and symptoms of Alzheimer's disease. We actually take those same signs and symptoms and use language that many African Americans are more familiar with. And we actually found when we did an empirical study that the culturally tailored text messages that we were sending actually had better results in terms of being able to increase people's knowledge about Alzheimer's disease. So one of the things that we're interested in is making sure that people understand what those signs and what those symptoms are. And then when they go to the doctor, and as you mentioned, Ms. Tisdale, it's very difficult to get a diagnosis. And so we sort of help and train and work with the people that we work with on ways to talk to their doctors, asking for cognitive screening as a regular sort of a type of care. If they take your blood pressure, ask for a screening as well, because it's very important that we get screened. And I'm hoping that someday it'll be universal care, right? That you go to the doctor, and that's definitely one of the things that they're going to do, particularly for African Americans who are 50 and older, because right now we're catching it too late for a variety of reasons. One is many of us don't know the symptoms when we see them. We are in denial. We excuse them. It's normal. People lose their memory, people become senile just because they're older, and that's not necessarily true. So one of the things we want to make sure is that people understand that there is normal aging, but certain types of memory loss is not normal, and that it's very important for people to seek care. But then once they ask for care, to help empower people so that they know how to have a dogged, determined request with their physician to make sure that they get the kind of care that they deserve.
And how important is it to have the family involved at the very beginning of this process and throughout?
It's extremely important. I mean, I can speak on a personal note. I noticed that my mother was losing her memory 4 years before I can convince my sister
Yeah.
that my mother was losing her memory.
Mhm.
My sister kept making excuses. Oh, it's because of this. Oh, it's because of that. I'm like, no, it's clearly she's losing her memory. Fast forward 3 more years,
Mhm.
because that's how long it took me to get the diagnosis. And it was a lot of advocating, speaking with her doctor, finding other doctors, calling geriatric physicians, calling people in Sacramento where my mother lives, calling the insurance company
Mhm.
to force the doctor to, give her an MRI so that we can actually see what's going on in her brain. And someone who is aware of this condition, who, understands the language, who is educated, who has access, had a very difficult time with it, right? And so I
Mhm.
can't even think about people who don't have access to resources and how difficult it is, which is why we do the work that we do at AAAE. But it's very important to have advocates, and families are generally the best advocate because the person is losing their mind, right?
Absolutely. Yes.
They can't
And
make
yeah,
decisions for themselves. And so not only is it important for families to be advocates, it's very important for them to be educated and to understand, what to expect. There's no cure. How do you plan for this? What kind of care is going to be needed, 2 years from now, 3 years from now, 4 years from now, right? There's a lot of legal issues and financial issues and health issues around that. Who's going to make those decisions? So
absolutely.
there's a lot of discussion that has to happen at the family level. And it's so important that families can communicate, right?
Absolutely. And your experience is very similar to my own, in what the challenges that I had in getting my mom the correct diagnosis, and
Mhm.
also the family members who were very much in denial.
Mhm.
And I even had one say, I'm not, let's not claim it, So if we don't claim it, it's going to go away, or that it won't be what it is. But it is important that, you have advocates and that the family is informed early on, educated, to understand the basic signs, and then have some sort of planning in place for what is to come,
Mhm.
because it does come in phases, and we need to be ready for all of that. So thank you so much, Dr. Lincoln.
You're welcome.
Pedra, I'm going to turn back to you. I'd like to know, how does Alzheimer's Los Angeles help families in need?
First, any question, we have a helpline number that anyone can call and again, get any question answered, starting with where do you actually go to get the proper diagnosis? And if they're seeing behaviors and they're not sure what's going on, if there are some issues with the person, there is a sundowning which occurs when the sun goes down, and there are some behaviors that occur, and sometimes family members have a hard time with that. Maybe there are issues with the person grooming themselves, bathing, and other activities of daily living. We are able to assist families with that. We do have support groups. Many of them are virtual by Zoom, or there are some that are still being had by conference call. We definitely have support groups for specifically African American men, and that one we just started. And so African American sons,
Great.
spouses, nephews, grandsons, they're welcome to join this group. It's specific for them, and I'm sure it will be really, really beneficial. We also have the Savvy Caregiver course, which is a free course for family members. All family members who are interested they're welcome to take this course, and they learn about the disease. They learn about their new role, as Dr. Benton said, as a caregiver, and what that actually means for them, and the journey as with them, and also the stages of the disease, and as well as decision making and things like that. So we offer a number of resources for families. They should just call us and we can go from there.
That is excellent news. And do you have a number that you can provide
Yes.
website?
Our number is 844-435-7259.
Excellent. Thank you so much, Petra. Dr. James, when we hear the word caregiver, and we know that, for example, IHSS will provide with sufficient supporting documentation, caregiver hours to individuals who have gone through that certification. What support is needed for the caregiver to be equipped to handle or provide adequate service to someone who's suffering from dementia or Alzheimer's?
Well, I think caregivers, first of all, need to know about what to expect in the disease process, or what at least the typical trajectory is likely to look like. Just knowing what's coming ahead can be very helpful. Also, I often tell patients' families to document all changes in a diary. So using dates and specific things that have happened, and to take that information to their doctor. So just knowing sort of how to manage navigating the healthcare system is also something that I think is it's a extremely valuable resource for caregivers. We have a very complicated health system, and as somebody who has worked in it for quite some time, I have seen people who really need a cognitive evaluation, their insurance deny it because the request or the referral wasn't written such that it wasn't a medical necessity, or at least it wasn't perceived that way. And so there's a lot of things with regard to getting access to certain types of diagnostic tests that is very complicated. And I wish that there was a support system for caregivers that they can actually learn about these specifics, particularly when it comes to navigating insurance. I think another resource that caregivers need is, as already has been mentioned, learning how to take respites and reduce stress levels, because being a caregiver is extremely stressful. And we know that the effect after the person is gone, the biological changes that often occur with stress still linger afterwards. So it's not like it just goes away, because it's been a chronic stressor that's been with that person for quite some time. So learning how to reduce stress levels in the context is extremely important as well.
As you were speaking, and thank you very much, Dr. James, for that response, I was thinking, again, going back to my own personal experience, the importance of the environment in which the dementia, the patient who has dementia or Alzheimer's is living in. We went through, the redecorating, making sure that family photos were on every wall, and had emergency call numbers posted to the fridge, and a list of all of the prescription drugs that my mom was taking in case of an emergency. Are there any other must-haves, any tips that you can provide to families? And this question, really, I'm going to start with Dr. James, but I'd like to hear from each of you on that.
The biggest issue is safety. So making sure that the home is, at least that someone's gone through to make sure that the environment is safe, because fall risk is very common in dementia. And so when most of the time, one of the greatest risks are falls. And then because we see that after someone has had a fall, and it often corresponds with dementia, we see a much faster decline. And so making sure the home, I think, in addition to all the things you have mentioned already, making sure that the home is safe is probably the number one thing, and that the person cannot go and wander off. Like there's some way of alerting the family members. So with my grandmother, when she was in her final stages of dementia, we had a little camera in the home to make sure that, you know, she was safe, or if something happened, if somebody wasn't there, there was a way to watch her. And we have a lot of technology advances that we can take advantage of. So that would be my recommendations.
Excellent recommendations. Dr. Lincoln?
Sure. Well, there's a lot of fear and denial associated with this disease, and I think it's really important for us to understand that, you know, when a family member or loved one is diagnosed or not diagnosed, but there clearly are signs of dementia, that they're changing, right? Their personality changes, their behavior changes. They're not the same person. And so one of the things that I've had to spend quite a bit of time talking to my family about regarding my mom is to stop reminding her that she's forgetting. So don't you remember? No, you remember. I mean, she's not the same person. Reminding them that no, she's not just being stubborn. She's losing her mind.
Yeah.
And she knows it. And so every time you remind her that she's forgetting, it's very stressful for her. So if she decides to wear that and it doesn't match, let her wear it. Or if she decides that the remote control is a phone, fine. Just let her believe it's a phone. Don't argue, right? Just kind of go with her disease, take her lead, keep her safe, of course, but not to continually remind anyone that they're forgetting, because oftentimes they realize that, and it's very stressful. So we also have to relearn and also learn how to interact with our loved ones who have dementia and are forgetting. And oftentimes we have to change our behavior, and we have to sort of let go of the person that we remember them to be and begin to accept the person that they are becoming and sort of stay in the moment. Because we'll lose those moments if we continue to sort of try to hold on to the person that they used to be. We're really going to miss the time that we have left with the person that they're becoming.
Absolutely. Excellent. Dr. Benton?
It's such an excellent point about being where the person is right now. I think the other thing that's helpful for families is to remember to have a routine. One of the things that's very helpful when you're starting to forget things is that if you just have markers, you know, try to keep your lunches and dinners and when bath time is, just having a regular routine helps to keep a calm environment. And so I think that's really important. And sometimes that's really hard because we know, you know, things pop up. But the closer we can stay to routine, not move things around, so that the person still can use what skills they have to follow that routine and make those associations. And also when we're talking to the person, sometimes we think it's really easy to say, okay, go into the room and go brush your teeth and get ready because we're going out today. And that sounds just like, oh, okay, that's how you normally talk. But instead, we have to remember that it's hard to, every one of those is a different step. So we have to learn as the family member to break things down into smaller routines and help guide that person and allow them to do what they can do and help guide them for those things that they cannot do and support the person when they need help. So if we're getting ready to go out for the day, it might be that you set up all the things to brush your teeth and then you say, oh, let's go into the bathroom and why don't you brush your teeth? And then they may say, you know, where do I start? That's okay. Start with the toothbrush. Help the person understand what that routine is. Lay clothes out. Don't give them 4 options for clothes. Maybe just go down to 2. if you want, so the person can choose. So the more that you can assist the person where they are. And I think that for us as family members, we also have to give ourselves more time to do things. We may forget, it's like, oh, we've got to be at the doctor's at 10 o'clock and, okay, well, that should take a half hour. No, give yourself an hour. And you know what? If you're going to be late to the doctor's, you call the doctor and say, I'm going to be late. Do you want me to reschedule or come later? It's okay. Sometimes it may not be that day. It may not just work out that day, but you have to give yourself some time and know when the person is a little more fresh, usually in the morning. So I know that many families will say, well, the doctor just said I had to come in the afternoon and that's when they have openings. I said, did you call back and say, that's not when it's a good time for my mom? Call back and say, no, I need morning appointments and let me, you're going to have to work with our schedule a little. And they can do that. But sometimes we're afraid to ask for a different routine from professionals. But it's really important to gauge those things because it'll be easier on everybody.
Absolutely. Excellent points. Pedro, did you have something to add?
Yes, everything that was said is so powerful and is also actually in the curriculum for our Savvy Caregiver course. So again, we'd love for family members to take this course. It's really, really beneficial. It really is necessary because this journey of caregiving can last for so many years. And it's really important to have some assistance, some support along the way. There are many people who have been caregiving for 10, sometimes 15 years, and that's a long time. And so to be able to build your support system, you can begin with Alzheimer's Los Angeles, and we will be happy to assist families again with whatever needs that they have regarding caring for their loved one in the community, because that's where all the care usually is taking place, in your home, in our communities. So we're here for you.
Excellent. Thank you very much, Petra. I've heard of sunsetting, and I don't know if this is a term that is used in the medical field, but I was once told that when the sun goes down, the symptoms increase. Can someone speak to that? Is that a true statement? And if so, why?
Some of the sunsetting, yes, that's a true statement, and many families find that this happens. It has to do with, kind of the change in light. And so we may not realize that, it's that dusk. And so if the lights in the house aren't on, there's that kind of transition. The other part is it's later in the day and the person has been up all day and their mind is probably tired. So we kind of start getting more behavioral symptoms later in the afternoon, and it seems to, and people are more busy. There's a lot of transitions that occur between 5 and 7. People are coming back from work. People are coming in and out. You're more likely to start getting different phone calls. So there's more disruptions. So I always think of sunsetting as that time when you have to allow for the lights to have been on. It's different in the summer, because it stays lighter longer. But no, so it's not exactly, there's not an exact time when sunsetting occurs, but I think of it more as that time when there are a lot of transitions between light, dark, between when people are coming back from home, all of the more disruption may be occurring in the home. I don't know, April may see it a different way. To add something to that, April?
Oh, I mean, that's a great description. I was just going to add that often the sleep-wake cycles that are regulated by a certain component of the brain become disrupted in Alzheimer's disease, and that is why we start to see that.
So I do agree, with what Petra was saying, is that it's important to get that support. We have the Alzheimer's Association. It's also, there's also the Caregiver Resource Center. And one thing for caregivers is we have the Stress Busters, just like the name says, of course, so that the caregivers can learn all of those respite techniques that we had discussed. And so it's, you can also, and we do, everything is individualized to the family caregiver. because it all starts with that conversation. So when you call us, we begin to have that plan so that we can be there with you the entire care journey.
Yes, thank you. Question for Dr. Lincoln. What can the healthcare system do to help support this population?
Well, I think that first and foremost, as I mentioned before, I really do believe that cognitive screening should be more universal. It should be part of brain health. Just like we screen for mammograms and we screen for prostate cancer, there just should be a normal screening process for people once they reach a certain age. And I think the earlier that you catch memory loss, the more options that people have, right? It may not be dementia. It may be memory loss due to some, physical health problem or some mental health problem or stress, right? So not all memory loss is dementia for everyone who's listening. But I think in terms of healthcare, there does need to be an acknowledgement and recognition that Alzheimer's disease and dementia is more prevalent in African Americans. So if you are working with African American patients and you are aware that we have a higher risk, there should be screening. There should be some discussion about memory loss. You should ask your patients, do you have any concerns about memory loss? Because it is something that we should be concerned about. And I think if it's initiated at the healthcare level with your primary care physician or your doctor, I think, you can start to engage in a conversation, because it's very difficult for those of us who might be impacted by this to bring this up to anyone, including our physician. So if the conversation is initiated by those who are providing our healthcare, I think it might be easier to open up the conversation about memory loss. And then, of course, as April mentioned, there are just so many barriers in terms of healthcare access, whether it's insurance, what's covered, who's going to pay for a cognitive screen. I just asked for another one for my mother, and the primary care physician was, well, let's talk about it. I'm like, we don't need to talk about it. Let's just do it. She has dementia. What is there to talk about, right? So I think, preparing yourself, arming yourself with information, arming yourself with the tools to be an advocate will really help you sort of deal with some of the issues that you're going to experience in the healthcare system, but recognizing that there are going to be challenges. It's going to be very, very difficult to change a system where there are embedded systemic inequities built into it, to begin to treat our folk, in a way that we deserve to be treated. So unfortunately, at this point, until there are more African American physicians, right, until physicians are trained in medical school to understand cultural differences and sensitivity and risk and disparities, we have to be our own advocates. And I think it's really important, which is why I do the work that I do, working with physicians, but really working with people in the community so that they are more prepared to deal with a healthcare system that's very complicated and that's very difficult to navigate.
And if you are a family member of someone who was diagnosed with dementia and or Alzheimer's, what is the likelihood of you later being diagnosed with the same? I think I'm going to ask Dr. James, through your research, have you found any correlation between the two?
I apologize. My Zoom had a glitch. Can you repeat the question?
Absolutely. If for the family members of a patient who has been diagnosed with dementia or Alzheimer's, what is the likelihood of that family member also later being diagnosed with the same?
Well, we know that their family history is predictive of who might go on to develop Alzheimer's. It's not 100%, but we do know that it is definitely a risk factor. There's a genetic risk. There are several genes that have been looked at, but there's one gene in particular that seems to be pretty common among those who go on to develop Alzheimer's. And so if somebody has family history, Sometimes they may want to get tested to see if they have a similar variant that might put them at risk. But then you have to be careful, because just because you carry the risk gene does not necessarily mean you're going to go on and develop. There's a lot of stuff that happens in between. There's a lot of environmental interaction with the way that genes express themselves. And what's particularly helpful, I think, to the message to get to the African American community is the amount of stress and a lot of chronic stress that tends to go on within discrimination within healthcare systems. I mean, it's there, it's prevalent, and in a lot of other sectors. So just being aware that we are seeing now in the research that for people who are at risk genetically for Alzheimer's, environmental conditions, environmental stress, chronic stress can actually alter those genes in a way where they may express themselves. So that's the link that we see today.
Thank you, Dr. James. We're talking about the individuals who have been diagnosed with Alzheimer's, and some of the risk factors, symptoms, some preventive tips that family members can take, some actions that can be taken to prepare for the journey that is to come. And with all of that responsibility for a caregiver, to have that alone is quite a bit, but to have that responsibility along with the pandemic, that is takes it to up a notch. I mean, the increase in stress on families. I can't imagine. Again, my mom passed away at the very start of the pandemic. But for those families who are going through this now, during the pandemic, this question I'm going to pose to Dr. Benton. How has COVID impacted Black families who are caring for someone with dementia?
One of the things that we really saw among Black families is that we might have been concerned before, but now we know that it could be deadly. And so being apart and not being able to be there close to the person that we want to care for, we could not necessarily bring as many people in to help for the caregiving. So that also increased the level of stress. There's a lot, because you're trying to explain to the person about masks, about why you can't get any closer, why there has to be more hand washing, why their nieces and nephews and can't come over and visit. And, the isolation is much greater. On the other hand, for those that might be in a multi-family household, it became more stressful because you had young children and you had the older adult. And so the risk, and you might be living in a smaller environment where you couldn't do the whole distancing, became harder. And with that, we also had a harder time once the vaccine started getting prioritized for vaccines. We know that the vaccine rollout was not equitable, that African Americans and Latino families were not equally getting access to the vaccine. So there were so many social factors that made our caregiving is going to last longer. It's still going to be more challenging post-COVID, or there's no post-COVID right now, but as the vaccine rolls out, we're going to still have a longer recovery. We're more likely to have lost jobs during this time. So the financial and economic impact is harder in our communities. So COVID has just uncovered what was there pre-COVID and really made a spotlight on why we have to deal with the inequities in our communities.
Yes. Thank you, Dr. Benton. Dr. Lincoln, for the dementia patient, the stress level of having to wear a mask, distance themselves from their loved ones, there's a lot of change in their environment. How do you think the additional stresses of COVID directly impact someone with dementia?
So honestly, we're all impacted, right? So I think with people who have dementia, it's very different because this is an interesting disease, right? Good days, bad days. And so what I've experienced with the community that I work with is that, obviously caregivers are stressed and have a higher level of stress as a result of COVID. But I think the social isolation has definitely impacted both, caregivers and people with dementia more than people who don't have dementia and who aren't caregivers. In terms of wearing masks, it depends, right? Every person is different. I think in general, we talk about wearing masks or not wearing masks, and people see it as a political statement to do so or not. With people who have dementia, who have memory loss, it could be uncomfortable. And what we have to do as caregivers is we have to learn how to talk to people who we're caring for, so they can understand why it's important. I've had to buy different kinds of masks because some of them feel suffocating. Some of them are more breathable. Some of them are more comfortable. I've bought colorful masks, things that I think my mom might like, that are pretty or that match her personality or that she might find more interesting to get her to wear her mask. And, sometimes she just doesn't want to wear it. And so we can't go out. But, we have to try different things, and we have to understand how to be flexible, right? If the person doesn't want to wear a mask, you're just not going to go out. Or if they don't want that mask, then maybe you should try something else. And as Donna mentioned, give them options. It's really important for people to be able to choose. But I think overall, for those who have dementia and for those who are caring for people who have dementia, they definitely have a tougher road to hoe during COVID. I have huge concerns about what we're going to experience on the other end as a result of social distancing, because I believe that social distancing, while it's keeping a lot of people safe, it is creating huge health disparities, particularly for African Americans. Food insufficiency has never been higher. Unemployment, loss of housing, distress, stress, death, mourning, businesses that will never open again, learning deficits, but for our kids. And so just the recovery on the other side of COVID is something that we really need to start talking about. I'm concerned about the seniors I work with who haven't been able to go out, who haven't been able to go to the senior centers. The risk of fall is huge, right? It's not just that they have higher levels of cognitive impairment, it's just they're having difficulty moving, right? And so I'm very concerned about what are the steps we need to take to reintegrate our seniors back into a normal life. It's not we open all the doors and everybody can sort of come out and start to participate. There are things that need to happen to make sure that people are strong enough, have the mobility and have the ability to be able to participate. So yeah, I think that those with dementia, those who are caring for people with dementia are significantly impacted by COVID. Those who don't have dementia and who aren't caring for people with dementia might have more issues now, more concerns. I think the risk factors have increased, right? Substance use, alcohol use, obesity, lack of sleep, all of the risk factors for dementia have increased for us. And so I would really encourage everyone to be concerned about your brain health and recognize the impact of COVID on our brain health. And that's one of the risk reduction strategies that I want to encourage people to engage in, to understand that your risk might have increased as a result of COVID. And it's really important for you to know what are those strategies to reduce your risk.
Dr. Lincoln, would you elaborate just a little bit more on that? So are you stating that COVID-19 may increase one's risk of Alzheimer's disease?
No, there's no evidence that COVID-19 increases your risk. So thank you for allowing me to clarify that. What I am suggesting is that some of the things that we need to do to adhere to the social distancing requirements might have unintended consequences for our health because we have to stay away from people, right? Social distancing means you have to keep your distance. And so churches have closed, and churches are very important opportunities for social interaction for many of our seniors and for our caregivers. But when you can't interact in churches or visit with your friends or visit with people in your neighborhood or have that kind of support, particularly for caregivers, obviously it's going to have a detrimental effect. And so, yes, I don't think there's no evidence that COVID-19, although there's preliminary evidence that, COVID-19 has some impacts on your brain function, but certainly, there's no COVID-19 doesn't directly increase your risk for dementia or Alzheimer's disease.
Thank you for that clarification, Dr.
You're
Lincoln.
welcome.
And for the very important information that you all have shared today. It's been quite insightful, very educational for the community as well as for myself. I feel really honored to be amongst you all. So thank you for having me. Before we come to a close, I would like to give each of you an opportunity to make a call to action, so to speak, to the community. What would you say to the community? What would you suggest be done, whether it's in a group setting, whether it's from an individual perspective? I'd like for you to please have a call to action to the community to support us through, and I say us because we are all the community, through these challenging times. Again, living with during the time of the pandemic, it's stressful enough, but also you have someone who is diagnosed with Alzheimer's, and that has its own stressors for the individual as well as their loved ones. What is the call to action to folks? And we're going to start with Dr. James.
My call to action would be to be mindful of the mental health issues that are sort of embedded within this conversation. We've been talking about stress, we've been talking about caregiving, we've talked about COVID and its post effects, and all of this is going to have a bearing on one's mental health. And I think mental health has been so stigmatized for many years. People are ashamed to admit certain things, and that makes everything else more complicated for the patient. If there are coexisting mental health issues, for the caregiver, and we know that mental health is going to be a significant issue post-COVID. And so I would just say that in addition to being aware of trying to detect cognitive changes, we also need to keep in mind that we cannot ignore the mental health piece.
Excellent. Thank you, Dr. James. Petra?
I want to say to the community, it's okay to ask for help. This journey is challenging. There's so many parts to caregiving for someone who has dementia, and it is difficult many days. So ask for help. and call Alzheimer's Los Angeles at 844-435-7259. We're here to help you.
Excellent. Thank you. Dr. Benton.
Okay. So I want to call on the community to really think about how we can engage our elected officials. Right now in California and even at the federal level, there are several bills that can support family caregiving. And I think that it's important that we ask how our legislators, our elected officials are supporting that. At the federal level, there is the CARE Act that is going through, and we need to call and say, we want, what's the hashtag is Care Can't Wait. It's part of the infrastructure. We as family caregivers are part of the national infrastructure. So we need paid family leave. We need sick time. In California, there are bills that are dealing with bereavement, paid family leave, paid sick leave, and long-term care, because we really, a lot of what we do as family caregivers could be made much easier if we had some type of long-term care insurance. So it is a time for us to reach out and say how this is impacting our families. And it really is just telling your story and saying that I know that there are bills to support me being able to be a family caregiver.
Excellent. Thank you, Doctor. Dr. Lincoln?
So my call to action is to get vaccinated. I got vaccinated. I'd be happy to share my vaccination story, but it's very important. I've never had a flu vaccination or flu vaccine. I've never allowed my son to have a flu vaccine. He's been completely vaccinated, but I got the COVID vaccine. And, it's really interesting for people who may have gotten a flu vaccination or some other vaccination and they may not even know the manufacturer, right? They just get the vaccination. We know the manufacturers. We know more information about this vaccine than we know about any other vaccine. And people, the more information we have, the less likely people are to get vaccinated. So I think, we're very informed. And I would really like to encourage everyone to get vaccinated. I know we're hearing stories about some of the side effects and the reactions that people are having. But I look at the odds of that happening to me, 1 in 1 million. And I figure I'll take those odds. If it were 1 in 4, I'd probably think twice about it. But if there are 1 million people get vaccinated and only one of us is going to have a severe reaction, I think I'll take those odds, right? You have a better chance of doing well and being vaccinated and being healthy and living and not dying from COVID if you're vaccinated than you do of winning the lottery, right? If you play every day for all of your life, you're less likely to win, right? So if it's a choice between winning the lottery and getting vaccinated, there's only one true winner, right? It's with the COVID vaccine. So that would be my call to action, is to please be informed, make an informed decision. But I highly encourage you to get vaccinated. Pick whichever one is available.
That is great, Dr. Lincoln. That's a wonderful way to end the session. I want you to know that I received my first dose of the COVID vaccine. And so I am going to continue on for that second dose. And I too send that call to action to the community as well. We definitely need more folks to get vaccinated. So at this point, I'd like to thank everyone on the panel for sharing your experience, your expertise, your contributions to the community, providing resources, and your overall commitment to the community. This is something that when I was invited to moderate, once I learned of the subject matter, I certainly didn't hesitate. I truly have grown from this experience. And I have a lot more information to share with others that are going through caregiving situations with folks that have beautiful loved ones who have been diagnosed with Alzheimer's. So thank you so much. I hope that our audience gained new and valuable information, as well as key takeaways that they can apply in their own unique situations. Again, it has been an absolute pleasure to be with you on today. Thank you.
At LA Care, community is food drives and back to school events, resource centers in your neighborhood, scholarships for future doctors, wellness programs and virtual care, affordable health care for all. Now more than ever, we are here for our community. For Covered California Enrollment Assistance, contact us today.